Welcome to Kootenai Health's Total Joint Program. We are honored that you selected us to provide your care during your journey to decreased pain, improved function, and a better quality of life. Our entire organization is here to help you be successful throughout the process of getting a new total joint. It is our goal to give you the tools and information you need for a successful surgery. This video was created to provide the tools and information necessary for an excellent outcome after surgery. We want to make sure you and your caregiver or coach understand the basic principles of our program and feel confident in the process. We want to make sure you and your coach know what to expect during your hospital stay and are prepared for a successful recovery. Finally, we want to make sure you understand how we determine when you will be ready for discharge, what to expect following surgery, and how to prepare to go home. The Total Joint Program was developed by our staff and designed to ensure high-quality care for individuals having a total shoulder replacement. Our general principles ensure that everyone is working with the same understanding of our program to collectively help you achieve your goal of a successful total shoulder replacement surgery. Principle 1. Keep in mind that the one thing that does not change throughout the surgical process is your role as the patient. You must be an active participant in your recovery. The most critical part of reaching an excellent outcome following total shoulder replacement surgery is your motivation and willingness to work hard. Principle 2. We understand that you are not going through this alone. Recovery from surgery often involves a support network. For you to be successful, we want to make sure that your coach is prepared to help care for you after surgery. Principle 3. There will be some pain as part of the process. A comprehensive pain management program will help control your pain following surgery. Our goal is for you to have well-managed pain that allows you to be comfortable at rest and actively participate in therapies. Principle 4. You should feel supported in this process by all members of our team. Principle 5. We want to make your time here as pleasant and relaxed as possible. Principle 6. Every person on our team will work together to provide coordinated care and help you achieve the best possible outcome. Principle 7. This process is designed to give you the tools and information you need to be successful in your recovery once you are discharged from the hospital and return home. Principle 8. This program and its treatments were created using evidence-based medicine, which means our program has been proven to be effective through research and best practice guidelines. Principle 9. Our goal is for everyone to be safely discharged home following surgery. We believe that patients recover with greater success in their home environment. Patients are more comfortable at home, and it's where coaches are most invested in a patient's success following surgery. Principle 10. After discharge, you should be satisfied with the care you received and should be prepared and confident in your ability to manage your recovery at home. Having a plan is the key to a successful recovery. Make your plan now to be better prepared for success. Prior to surgery is the best time to arrange all of your care and appointments. Having a plan helps you be more prepared and leads to better outcomes. Once you decide to move forward with surgery, your surgeon will determine what tests you will need prior to surgery. You will schedule a surgery date, schedule pre-operative appointments, schedule follow-up appointments, plan for physical therapy, and arrange for transportation. Your time at the hospital is typically very short. It is our goal to make sure you feel confident prior to leaving, so you will be successful in your recovery at home. You will begin outpatient physical therapy 24 to 48 hours after discharge, and your surgeon will monitor your progress. While you're in the hospital, there will be a number of people working as part of your healthcare team. Each individual brings their own expertise and will contribute a unique skill set to help you be successful. Here are a few of the members on your team. Surgeons. The surgeon and their team will be the ones performing your surgery and guiding your care during the hospital stay. This team may include a physician assistant, a nurse practitioner, or an orthopedic navigator nurse practitioner who will work together to guide your care while you are in the hospital. Anesthesia. The anesthesia department here at Kootenai Health includes anesthesiologists and nurse anesthetists. Orthopedic navigator nurse practitioner. The orthopedic navigator nurse practitioner is directly involved in all aspects of the total joint program. This individual is responsible for ensuring that all departments work together to provide high-quality healthcare. Nursing. The nursing department is here to attend to all your healthcare needs, supporting your overall health following surgery. It's important to ensure good, clear communication with your nurse, as they will be the key member to answer questions and manage your care. Physical therapy. The physical therapy department is responsible for helping you begin your rehabilitation following surgery. They will work with you to improve function, return strength, and regain motion of your joint. Occupational therapy. Occupational therapy is here to help you function in your activities of daily living following surgery. They will help you with tasks such as putting on your shoes, getting in and out of bed safely, and getting dressed. Pharmacy. Pharmacists will help you manage your medications during and after your hospital stay. Care management. The care management team is responsible for making sure you have the support at home you need to recover successfully. It is important to understand that a successful recovery begins with having a discharge plan in place prior to surgery. Here are the things to consider as you plan for discharge. Who is going to be your coach or caregiver? What things will you need assistance with after surgery? Who will help you manage your activities of daily living until you are able to resume them on your own? What will you do for work? Usually, it will take 2 to 3 weeks before a patient can return to a sedentary job following surgery. Jobs requiring extended walking or driving may take anywhere from 4 to 6 weeks before you can return to work. Returning to manual or heavy labor jobs may need to be postponed for up to 3 months. Do you have levels or stairs in your home? You may want to choose a level of your home that offers the most amenities to limit the need to travel up and down stairs. Review the home safety checklist in Appendix B of your binder to ensure that your home is safe for recovery. Returning to a safe environment is critical to prevent injury that can complicate your recovery. You will be unable to drive for 4 to 6 weeks. You will need to arrange for transportation to and from the hospital and to your appointments following surgery. Please review the medication list in Appendix A. There are a variety of medications we would like you to stop using 7 to 10 days prior to surgery. If you have questions about medications, please discuss that information with your surgeon. Through the surgical process, you will be exposed to several things that may lead to constipation. We recommend that 2 to 3 days prior to coming into the hospital, you take a dietary supplement to help ensure regularity. This includes over-the-counter medications such as Senokot S, Miralax, and Metamucil. Unless you take an experimental or specially compounded medication, you do not need to bring any medicines with you to the hospital. If you use any device for sleep apnea, including a CPAP machine or an oral device, please bring it with you to the hospital. The use of these devices will be essential to preventing complications related to your sleep apnea. Bring loose-fitting clothing, non-skid shoes, and personal items. Please refer to your binder for further details on clothing. Finally, please bring your total shoulder binder. It will help to keep you informed and it will be utilized by our therapy staff to help build your home exercise program. Pain is expected after surgery or injury. Now we will discuss how to best manage pain for a successful recovery. At Kootenai Health, we use a scale of 0 to 10 to determine your pain rating. 0 is no pain, while 10 is the worst pain imaginable. It is our goal to provide excellent pain relief. In order to do so, you and our staff need to be able to clearly communicate about your pain. To do this, we use the Kootenai Health Pain Tool to communicate as clearly as possible regarding your pain. Use the words, faces, and descriptors to help us understand your level of pain. On the back of the pain tool, we list detailed descriptions for what each number may mean. When using these descriptors, simply read them and find the one most accurate for you at the moment, and inform the nurse of your rating. Also, on the back of the pain tool are the patient expectations for pain management. These expectations are important to help you understand how we work to manage your pain, as well as what you as a patient should expect from the pain experience as a whole. First, it is important to understand that we will be using the lowest dose pain medications possible to achieve pain control in order to avoid unwanted side effects from pain medications. Second, it is important that we set a reasonable pain goal based upon your own health history. Everyone is different. It is also important to understand that pain is expected following surgery, injury, or certain diagnosis. Some pain may be present, and it is not always medically safe to try and achieve a pain-free state due to potential side effects from pain medications. You should expect to achieve a resting pain goal that allows you to recuperate and be comfortable at rest. The most predictable time that we can control your pain is when you are lying or sitting still. For the majority of our patients, we suggest a resting pain goal of a 3. This level is when your pain is discomforting, but you are able to easily ignore it, and you should be able to sleep and interact with your family and staff. Though we will do everything we can to achieve your resting pain goal, expect that pain will increase with activity. It will typically be 2 to 3 points higher than your resting pain goal, and you should still have enough pain relief to actively participate in therapy. Once back at rest, your pain should start to return to baseline in approximately 30 minutes. It is important to maintain consistent pain management during the night. We may need to wake you during the night to assess your pain and possibly administer more pain medications in order to maintain consistent pain control. This will help to keep you from getting behind and waking up in more pain. Please expect that if you are having undue side effects from pain medications, we will hold those pain medications and develop a new pain plan. In addition to the pain scale, your nurse will use a patient communication board to track and monitor your pain level. Your resting pain goal will be listed on the board so you and our staff can be working toward your desired goal for pain management. Additionally, when as needed or PRN pain medications are given, your nurse will write the last time they were given and when the next dose is available. This will keep you informed regarding your pain management. Getting ready for surgery. It is important you do not eat or drink anything after midnight in preparation for your surgery. Please stay well hydrated the day prior to surgery. Staying hydrated will help to lessen any low blood pressure concerns following surgery. Please try to have a bowel movement, if possible, to decrease the severity of constipation. Please remember not to eat or drink anything prior to coming to the hospital. It is okay to take your allowed normally scheduled pills and pain medications prescribed by your surgeon on the day of surgery with a small sip of water. Please discuss with your surgeon if you have any questions. If you are a diabetic, please do not take your oral diabetic medications. It is important to check in on time. If you're going to be late, please call and let us know. The phone numbers are available in the back of your book. The total time of surgery includes the preoperative phase, the surgical phase, and the recovery phase. The total process usually takes 3 to 4 hours. Family members will be able to see you once you have arrived on the floor and have had an initial evaluation by your nurse. Once done in the operating room, you will be taken to the recovery room where you will remain for approximately 45 minutes. After the recovery room, you will be taken to the hospital floor or secondary recovery area where you will stay until you have met the criteria to be discharged home. Discharge planning. Following surgery, we want to ensure that you are prepared to be successful in your recovery following discharge. Before you are discharged home, you will need to achieve the goals listed to ensure you are prepared. Meeting these criteria will help us know when you are physically ready and safe to discharge home. The tasks will be monitored by staff. As you accomplish these tasks, they will be checked off. Once completed, we will know you are physically ready to be discharged home. We must also ensure you are medically stable enough to be discharged by achieving the patient stability goals, which include tolerating an oral diet, passing gas if discharged between 24 and 48 hours of admission, or a bowel movement if discharged after 48 hours of admission. You must be able to urinate without difficulty and have a pain plan in place. Following surgery, we will begin working on the criteria that need to be accomplished before you are able to safely discharge home. You will be allowed to eat or drink a meal as tolerated based on your medical history. Most people will tolerate a small meal or two the day of surgery. During your stay, we will develop your home pain program. At our facility, we utilize a pain management philosophy that minimizes narcotics and uses a combination of medications that work in different ways. This approach allows us better pain control with fewer side effects, resulting in happier patients. We use IV pain medications sparingly and focus on using oral pain medications. You will also have cold therapy with ice to help decrease pain and swelling. After surgery, physical and occupational therapy will begin right away. Physical therapy will work with you once or twice a day to help meet your functional discharge goals. Occupational therapy will work with you once a day to help you function better in your activities of daily living. As soon as it is safe to do so, we will ask you to get out of bed to the chair for your meals. This early ambulation and activity will help to promote blood flow and stimulate the lungs and muscles. Our staff will determine when you are safe to get up and move to the chair. Since you will be ordering your food yourself, we ask that you let us know approximately 15 minutes after ordering your food so we have time to help you get to your chair before your food arrives. After surgery, there will be things that your surgeon will prescribe in order to prevent complications. First, you will have knee-high stockings, squeezing the lower legs to promote blood flow to help prevent blood clots. You will also have wraps around your lower legs called sequential compression devices that will help to massage the lower leg to promote blood flow and help prevent blood clots. A shoulder immobilizer will also be in place to support your arm during the healing process. Your surgeon may also prescribe a blood-thinning agent to help prevent blood clots if they feel it is necessary. Lastly, you will receive an incentive spirometer to promote good respiratory function after surgery, to prevent fevers, wean you off of oxygen, and prevent pneumonia. Our team will continue to assess your individual progress and needs on an ongoing basis during your stay. Once you have met your home discharge criteria, you will be discharged home. Care management will assist if needed in arranging post-hospital services for the patients unable to reach their home discharge criteria within 48 hours. Once you have achieved the discharge criteria, we know that you are prepared to go home and be successful in your recovery. We will continue to work with you and help you achieve the criteria at a pace that is appropriate for you. It is important to begin your rehabilitation promptly after discharge. Please arrange to begin outpatient physical therapy 24 to 48 hours after discharge. Once in therapy, you will be seeing your therapist 2 to 3 times per week for 6 to 8 weeks. They will continue to work with you and your surgeon to maximize your recovery and function. Keep hydrated and continue good nutrition. Once at home, it is important to actively treat for constipation, maintain consistent pain management, and monitor for complications. Once you are home, it is up to you to continue to try and maintain your resting pain goal by following your pain plan. If you have questions or need further assistance with your pain plan, please discuss with your surgeon so they may advise you on any appropriate changes. If your surgeon believes you may have an increased risk for blood clots following surgery, they may prescribe anticoagulation medication. If prescribed, please follow their instructions to reduce your risk of suffering a blood clot. Though complications are rare, if you have any concerns, please contact your surgeon immediately so that issues can be discussed and addressed prior to potentially serious complications. Therapy. After your surgery, it will be very important for you to complete your home exercise program as instructed by the therapist. Your surgeon will provide clear instructions on how to move your arm and shoulder after surgery. The therapist will teach you how to do these exercises and motions after surgery according to your surgeon's wishes.
So we're going to rest your arm on the pillow there. And so the first one is going to be for your wrist. It's wrist flexion extension. So with your arms supported on the pillow, we're going to bend it up and down. And this is for circulation, maintaining range of motion and strength in the wrist and the forearm. Just like that? Yep. Okay, and then the next one is in the same position. You're going to roll your palm up and palm down. So this is forearm pronation and supination. This is for range of motion, circulation, strength in the forearm. Okay, good. And then I'm going to take the pillows out and have you scoot forward a little bit. And then go ahead and let your arm down. Use your right hand and grab under your wrist and let your arm straighten out all the way. And then assist it back up. And then let it all the way down. So this is active assisted range of motion at your elbow. I'm trying to regain range of motion at your elbow. Okay, good. And then we'll put the pillows back under. And now we're going to move to the shoulder. So we're going to do shoulder forward elevation. So you're going to use your right arm as much as possible to help raise your left arm. There we go. And go up as far as you can tolerate. And just try to keep that left arm relaxed. Okay, and then the next one, take the pillows, tuck them in there a little more, and we're going to rest your arm on the pillows, keep your hand under the wrist, and this one is shoulder rotation. So what we're going to do is we're going to go side to side. So we'll bring it in, and then we'll bring it out. So again, try to use your right arm to do most of the work. Try to keep your left arm as relaxed as possible. Okay, good. I'll take the pillows out and I'm going to have you stand up. And the next one is going to be a pendulum exercise. So you're going to rest your right hand here. And you're going to spread your feet wide and put one in front of the other for stability. And then let your arm hang down, and you'll just sway back and forth. So bend at the waist a little more. Straighten your knees a little bit more and bend at the waist. There you go. And then just let the arm relax. Think of the nose of an elephant. Okay, good. All right, so now we're going to use a pulley to help regain shoulder range of motion. So you're going to use your good arm, your right arm, to pull down and lift your left arm. And then you let it down. Bring it down all the way. And then again, raise it up. Use your right arm to do all the work. And then let it back down. And always make sure you stand up nice and tall when you're doing this. Okay, good.
Though many patients are surprised at how quickly after surgery they are able to get up and move around, recovery still takes time. For the first 1 to 2 weeks, we expect that most of your time is spent participating in short bouts of activity every couple of hours during the day and participating in outpatient therapy. You will still require frequent periods of rest. Sometime in the 2 to 4 week mark, patients will get stronger and be able to tolerate longer bouts of activity outside the home and will be able to start weaning off pain medication. After 4 to 6 weeks, most patients make excellent progress. They will be tolerating extended trips out of the house and will continue to get stronger. Around this time, people may be close to being off or off their pain medications altogether. At 3 months, most patients will be feeling fairly well. They will start returning to activities as tolerated and will likely be out of their brace. Please make sure to clarify any questions you may have with your surgeon during your preoperative appointment. And feel free to call us at the hospital if we can be of any further help in preparing for surgery. Thank you for choosing Kootenai Health's Total Joint Replacement Program for your shoulder surgery.